Hi, Tigran. I'm here. Hi.
Judy, how's it going?
Oh, it's going really good. Thank you. How are you?
Doing well, doing well. Ready for the weekend.
Yes.
Appreciate
Yeah.
appreciate you joining us. And I'm going to
Yeah.
give folks a few more minutes here to
Yeah,
um, trickle in, and then I'm going to try to figure out
absolutely.
how to properly show my presentation without all of the slides showing, because I can never figure that out for some reason.
Hello.
Hi, Allie.
Oh, I don't know why it says I'm Judy Polikoff. I'm gonna fix that. Hmm.
Hi, I think I might be Judy Polikoff. I don't know
You know
why.
what? I forwarded the invite to all my team. I
Oh,
bet you're all Judy Polikoff today.
I
Um,
was looking, I'm like, where am I? I've never been to a meeting where I don't show up.
I've never been so important in my life.
Oh my
Everybody's Judy
gosh, you
Polikoff.
are. Let me fix all this and then I'll come back.
That's hilarious.
It's an
Can you?
honor, Judy. Really.
Thank you.
Going to give it a few more seconds here until
No
we can get a
problem.
few more folks.
No problem.
Thank you guys for joining us.
Thanks for having us.
Can you guys see my screen?
We can.
I never know how to get rid of this. When I share my screen, it shows all of the slides.
I have you put it in presenter mode? Do you know how to do that?
Enter views that.
I do it down on the bottom, in your bottom right-hand corner where you have the little plus and minus, just to the left of the plus looks like a little monitor screen. If you click on that, it will take it to presenter mode. I'm the least technical savvy of my group, so if somebody else wants to chime in, but that's how I get to it.
That's what I usually do too, yeah. The over further to the left of the
At the very, there you go. Now, yeah, if you
you go to
on the
the
left,
very top, yeah, on the left hand side in the display settings. Oh, no, that's to the PowerPoint side.
Sorry.
Oh,
that's
no,
okay.
I'm sorry for being late. I've had nonstop meetings right up until now.
That's okay, Lori. Hi, we're
wonderful.
doing some technical dancing here.
Okay, great. And I haven't had my lunch, so I have a bowl of yogurt, yogurt and fruit. So I'm gonna come off camera while I
No
keep
problem. There you
eating.
go. So Tigran, right from there, just under the larger, on the left-hand side, you see those three ellipses on the left-hand side. There's a bunch of icons underneath your screen. A little bit lower, there's the three little dots. Oh, those are ellipses. The three little,
Oh,
there you
right
go.
here.
Click there,
Yeah.
click. Yep. And then hide presenter view. There you go. Click. There. Oh, why didn't that work?
Yeah, maybe my PowerPoint's a little weird. Not a
Huh.
big deal. I'm just gonna go ahead. It's not too much info on the presentation on my end at least, so it shouldn't be too
Okay.
much of an issue.
No worries.
Okay, well, sorry about the technical difficulties, everyone. It's Friday. Let's chalk it up to that. So I'm going to go ahead and get started. I think we have the majority of our turnout here. Thank you all for joining us. My name is Tigran Agdayan. I'm the manager of advocacy and public policy for Breathe Southern California. Today's briefing is the second in our ongoing series to just discuss wildfire smoke mitigation. If you're unable to attend our first session, which discussed the impacts on public health, I'd be more than happy to share the recording. Please just let me know. I'd like to provide a brief background on our organization, Breathe Southern California. We're a century-old nonprofit based in Los Angeles, whose mission is to promote clean air and healthy lungs through research, education, advocacy, and technology. We work to provide resources that educate families living in the Southern California region to improve their community's air quality and lung health. We have several different programs throughout Southern California that aim to improve air quality, reduce public health impacts of air pollution, and also assist individuals living with lung diseases. We work with local experts, community members, and policymakers to advocate for the best practices to ensure we are protecting not only the air we breathe, but the people that breathe it. Today's briefing will discuss the implementation of AB 619, passed by Assemblymember Lisa Calderon in 2021. Our organization was fortunate enough to work with Assemblymember Calderon on this bill, and we're thrilled to be seeing it come to fruition. For context for everyone, the idea of this bill stemmed from the reality that, as we all know so well, wildfires are an unfortunate part of California's climate. Even as we speak, there's a number of fires burning throughout the state. We know smoke exposure can be devastating both in the near terms and long terms. So, we see spikes in emergency room visits during these times. Children often miss schools, parents miss work, and now we're actually even seeing smoke exposure linked to diseases such as dementia. Through our research and experiences, we realized that wildfire smoke management and mitigation are often a piecemeal strategy that cities and counties may handle in different ways. What a county like Los Angeles may do can vastly differ from smaller counties in our state that don't have access to the same resources. While the state, local air quality management districts, cities, counties do provide various resources, both educational and physical, like PPE, oftentimes resources are limited and individuals often don't know where to look to find information or assistance. Knowing that, we realize more consistency is needed when managing wildfire smoke events. AB 619 empowers the California Department of Public Health to develop recommendations and guidelines for counties to use during these significant air quality events that increase the presence of harmful particulate matter, such as wildfires. It also requires counties to incorporate these guidelines in their next emergency plan updates and provide lung health related information to the public. I'd like to now turn it over to our speaker, Judy Polikoff. Judy has worked in public health for the state of California for more than 15 years. She's a research scientist currently in the Environmental Health Investigations branch of the California Department of Public Health, working on wildfire smoke exposure and the implementation of AB 619. Judy and team, thank you guys for joining us today. Before I turn it over, I'd like to encourage all attendees to write their questions in the chat box as they arise. Following Judy's presentation, we'll have time for some Q&A. Judy, I'll turn it over to you.
Thank you. First, let me share my screen. Let's see, here we go, here it is. the buttons move around sometimes. Oh, I have to send a request. Request has been sent. Oh, there we go. Okay, here we go. Share. There, can you guys see my first slide? Wonderful. Well, first of all, thank you so much for inviting us and including us today. Yeah, I'm going to give a brief overview of the legislation, and I'm going to talk about what we've been working on, what we've accomplished, where we're going. But before I start, I do want to introduce the team because this is a team effort. So first I have Allie Smith with me. Allie is also a research scientist. And I want to say that Allie and I are the only two full-time employees with CDPH who are working on the implementation of AB 619. We also have with us Constancia Dominguez Vong, and Constancia works with us part-time and she works on other projects part-time. Her position didn't get filled till very recently, and we're very, very pleased to have her join us. She brings expertise on masking and other protective equipment. So she's been a great new addition to our team. Also part of our group is Ashley Kissinger, who you guys may know. She's head of California Breathing, which is our state asthma program, and we are fortunate enough to be able to work with her and glean her expertise and have her guidance. And of course, Lori Copan oversees our team. She has lots of people working under her and lots of programs, but we are her favorite, I'm sure. And that made Lori laugh. I just want to say in all seriousness, we are very proud of the work that we are doing, and we are very pleased to be able to share it with you today. So thank you. So here we go. Let's get to it. Oh, hang on. Got to advance the slide. There we go. Don't worry, not all the slides have this much text. Stay with me. So first of all, what is the Wildfire Health Plan Initiative? As Tigran said, AB 619 requires the Department of Public Health, or CDPH, to develop this statewide plan for counties to use to help protect residents against wildfire smoke. And there's two main focuses of this plan. And one, it's really developing better risk communication. And by that, I mean how a county informs its residents about unhealthy air quality, what are the impacts on our health from smoke, and how can residents protect themselves. And when we think about risk communication, we're thinking about how we outreach, education, messaging, and health literacy. And I'm going to talk a little bit more about literacy in a second, but that's kind of how we're thinking about risk communication. It's written into the legislation that our plan must address protecting our most at risk and our most vulnerable to the adverse health effects of wildfire smoke in the population. So who are we talking about? We're talking about those people who, based on their stage in life, so young children who are more vulnerable to the health impacts of wildfire smoke, older adults, we consider over 65 as older, women who are pregnant, people who have pre-existing health conditions like asthma and COPD, as well as heart disease. We also think about people who we consider having social vulnerabilities, so may not speak English, or may not have the same access to healthcare, or outdoor workers who are out in the smoke all the time. So there's a lot of considerations when we're thinking about people who are most at risk and who are most vulnerable. And also, the plan must include guidance on stockpiling and distribution of emergency provisions, so masking, air cleaners or air purifiers, and the like for our residents who are most at risk from wildfire smoke exposures. And I just want to go back to this about literacy and why literacy is so important in our work. And I mean, the truth is, illiteracy has become such a serious problem in our country. And the National Literacy Institute provides statistics on literacy in our country. And to me, it's just so shocking, really. They say 130 million adults are now unable to read a simple story to their children. 21% of adults in the US are illiterate. That was as of 2022. 54% of adults have a literacy below 6th grade. level. That's 2024 data. And so shocking to me is California has the lowest literacy rate of all the states of the 50 states. We have the lowest literacy in our wealthy and big state that we are. So that's why we think about literacy so much in our work. Okay, so what have we been doing? As Tigran said, the legislation was passed in 2021. We didn't get funding allocated until 2022. I was one of the very first people hired, and that was in January of 2023. So we got a little bit of a slow start. That's just how state bureaucracy is. And but we have been running strong since the beginning of 2023. So we've accomplished a lot in 2.5 years now. So the first thing we did is CDPH met with more than 30 interested parties or entities that are listed in the legislation to get an understanding of their expertise and their knowledge and their insights about wildfire smoke risk communication and local community needs. We also wanted to reach out to community members, to individuals, especially those, particularly those who are more vulnerable and in these higher risk groups. We say it's like ground truthing, but here we are, we're developing these guidelines, and we need to know that they're based in reality. We want them obviously based in science and best practices. All that is so important, but they also have to reflect what's reality for people and how that's in order to have a meaningful document with meaningful impact. So we interviewed over 100 individuals from different communities to understand their experiences and what they've done in the past to protect themselves. And I'm going to share that what we learned from those surveys after I go through this slide. We'll get into that in more detail. The other thing we've been working on, we are in the final stage of completing, we've developed an interactive, like a curriculum or toolkit, if you will, for community health workers who are linguistically equipped and culturally they are best equipped to educate vulnerable residents about the health impacts of wildfire smoke. And we want this to be shared. We'll share it directly with community partners. We're going to also share it with counties as a resource for effective health risk communication. We know counties don't have, for the most part, the resources or even the expertise to do some of this work. And in order to really get at the heart of what this legislation is asking for is to be able to educate communities and help residents protect themselves. We developed this curriculum for counties to use as a resource, but really it's all about getting this information out to individuals so that they can protect themselves. And I can talk more about the toolkit later too if there's interest. So in addition to all of that, we have also conducted a thorough review of the scientific literature on risk communication and outreach so that we do know what the science says about how to effectively reach our populations of concern about the health effects from and how to protect people from wildfire smoke. That's been very important for us. We also have done a comprehensive review of existing wildfire smoke risk communication materials and messaging for the public that's on the 35 local air district websites, as well as public health, county public health websites. And we've been assessing the content based on accepted health literacy principles and other criteria for accessibility and all of that to get an idea of where we stand, where are the gaps, what's needed. So we've been busy. So there you have it. We've been very busy. I want to talk a little bit about the surveys that we did because what we have learned from the surveys is so important, and it really is helping inform the work that we do. So like I said, we wanted to understand community experiences during recent wildfire smoke events. We wanted to know what actions people have taken, and we wanted to know where people are getting their information from during wildfire smoke events. We focused this project on the Central Valley because we know the Central Valley is home to many low-income communities of color with fewer resources for avoiding smoke. We also know there are language barriers, health conditions, food and housing insecurities. We have the Central Valley is home to hundreds of thousands of outdoor workers. So lots of challenges and barriers for people. So we really wanted to focus on these communities. So we developed a survey. We worked with community-based organizations from across the Central Valley, 4 in particular. And we chose to work with these CBOs because they are trusted in their respective communities. They, as I said, they're linguistically and culturally best equipped to work with community members. And the populations that these particular CBOs serve are groups disproportionately burdened by wildfire smoke. So we had community health workers and outreach workers from each of these organizations collect responses. We have 200 responses so far, some in English, some in Spanish. There were 16 questions total, some multiple choice and some free response where people could just speak freely. And here's what we have found. So overall, our respondents described how wildfire smoke greatly impacted their lives and the lives of their families. Some of the primary things that surfaced from this, they talked about negative impacts on physical health, on mental health, on their ability to work, and also how these wildfire smoke events caused major disruptions to daily life. In addition, when there was extreme heat along with wildfire smoke, it just compounded things and made an already difficult situation that much worse. In regard to communication, so when you look at the slide up in the corner, you'll see this N equals 76. That's the number of people that are incorporated into this particular graph that I'm showing. But so I'm going to do for the next few slides, you'll see that number kind of pop up, different numbers there. But this question had to do with information. And we asked participants where they went to find information about wildfire smoke during recent wildfire smoke events. And this was a multiple choice question. On the left is the list of the sources that we specifically asked about. It was multiple choice. They could choose all that apply. And what we found was that the people who participated in our survey, they used a wide range of sources to find critical information during wildfire smoke events. Television was the most frequently reported source that people went to, followed by the weather app on their cell phones, and then radio and social media. Websites, only 20%, less than 20%, looked to websites for information. Under other, that part was free response. So they check all that apply, but then they had a place where they could add anything else that they wanted. And some of the responses we heard were text messages from the county, word of mouth from family and friends, the school flag program, work, and also just looking outside, seeing and smelling smoke. When we looked at it more closely, we found that the source, like where people go to find information, it really varied by their age. So in this graph, each of the colored bars represents a different source that we had just asked about. And then they're separated out by these age groups along the bottom. And starting from the far right, we're looking at people who are 65 and older. And older adults most frequently relied on television of those we spoke to. They also relied on radio, and they used mobile apps and social media a little less. They didn't use the internet at all. Participants between 35 and 44, they accessed information from all the sources we asked about. In this group, radio was the most frequent choice, but also TV and internet, also cell phone and social media. And those under 24, the youngest of the groups, social media was most frequently reported source for finding information. When we asked people how they prefer to get information, if they had a choice, overwhelmingly people requested text messages. They said text messages, they provide current information, and it's easily accessible. And this was a free response question. People could say anything that they wanted. And what's so important to us about this information is that in public health and other government organizations, we consistently refer people to airnow.gov, which is a wonderful resource for many, many people. It's a wonderful resource. But the results of our project, our study, really underscores the need to communicate information through multiple sources, multiple platforms, multiple technologies in order to reach the greatest number of people, that we can't just rely on a few things. Switching gears just a little bit, we also in our surveys asked about masks. We want to know if people are wearing them and what ones they were wearing, what were they doing. This chart shows the kinds of masks that people wore during the last wildfire smoke event. Participants were shown photographs, so they shown pictures of the various masks, and then they could choose all that apply. Multiple choice, choose all that apply. We found that about 2/3 of the people said they wore surgical masks. About 37% wore N95 masks. Nearly 1/3 wore bandana or cloth, and about 8% said they didn't wear a mask at all. And what's really important here is that N95 masks, they're the gold standard. They are by far the best at filtering out the particles from smoke and protect us the best. If they're worn properly, they can filter out 95% of the particles from smoke that are so bad for our health. Where surgical masks only filter out about 20%. Now, surgical mask is still better than no mask. It's not that we still want, we still want people to wear masks, but we really want to figure out how to move people to wearing a more protective mask. And what are the barriers? Is it that people can't find them, can't afford them, they're uncomfortable? Like, what is it going to take for us to help move people to wearing something that's more protective? We were also very interested in outdoor workers. In California, California state law requires employers to provide N95 masks for voluntary use when the air quality index is over 150. And we wanted to know, are outdoor workers receiving masks? We had 89 outdoor workers in our survey. 86 of them answered this question. We asked, did your employer give you an N95 mask to wear when there was a lot of smoke in the air? And the choices for response were yes, no, or my employer gave me a different mask. And of those that answered the question, still more than half said, 56% reported that their employer did not provide them with an N95 mask. Only 42% reported that they did receive an N95 mask, and 2% said their employer gave them a mask, but it was a different mask, so it would be a less protective mask. And then just looking at overall all the outdoor workers, whether they brought a mask of their own or whether it was given to them, we just wanted to know in general, what are outdoor workers wearing? And again, the most commonly worn mask among outdoor workers was surgical masks. And so we want to continue working with community partners to figure out how we can move people to wearing a more protective N95 mask and what the barriers to that are. As part of this work, we interviewed 30 individuals who are deaf or hard of hearing. When we asked participants about their experiences during wildfire smoke events and the challenges that they faced, many shared about the barriers to accessing information. Many participants said they did not have the information they needed to keep themselves safe during wildfire smoke events. And there were many factors that they kind of gave as contributing factors to why that was. First, many participants described feeling that news media isn't accessible, that whether it was on TV or social media, or wherever they were looking for news, that news programs lacked closed captioning, or they lacked live ASL, American Sign Language interpretation, leaving people uninformed. This other thing people talked about was that information about wildfire smoke and safety was difficult to find. So if they went to go look for it, whether it was on social media or on the internet, it was very difficult for them to find accessible information. In addition, people talked about that vital information was not timely. They felt like they described a feeling of being the last one to find out about information, and they remarked on the inequities due to inaccessible information. And lastly, much of the information that participants could find the access was incomplete. So people want more information, and they want it in an accessible format. They offered solutions, which was incredibly helpful for us to hear. Participants shared multiple suggestions of how to better reach individuals who are deaf or hard of hearing in the future. There was a strong call for all kinds of media to be more accessible. And they said that, closed captioning is not enough. Not everybody can read closed captioning. So it's using ASL. It's using pick and pick, which is shown on the slide, a picture within a picture of someone with ASL translation. There are creating vlogs or video platforms using ASL to share information. There were a lot of suggestions of how to make news more accessible. They also talked about, wanting text messages, and they felt that one of the important things was that text messages, it was much easier if the information came to them than if they had to go and look for it. And also they need all of the same things that they said in the previous slide about needing all that information to be accessible and all the ways it can be accessible. That's what they need in text messaging. So links to videos that have accessibility so that they are getting that same information without those barriers. And they also mentioned that in the past, in-person outreach during events was incredibly helpful, that NorCal Services for the Deaf and Hard of Hearing, who's the partner organization who helped us in this project, they have in the past gone door to door, and they talked about how important that physical outreach was for them. So I just want to take a minute and really acknowledge the groups, the organizations who we've been working with and who spent the time to collect this information. Without it, we could not have done this work. And those organizations are on the slide. I mentioned NorCal Services for Deaf and Hard of Hearing, but there's the Judah Project, Valley Onward in Merced, Little Manila Rising, and also the Central California Environmental Justice Network. So now what are our next steps? Where are we? We are writing our document now. We're taking all this information. So the information that we learned from our communities, the information that we learned from our the interested parties we interviewed, the scientific research that we got up when we looking at best practices for risk communication, what we learned from looking at the websites and what information is already out there. So we used all of this to kind of inform our recommendations that we're working on now. Once we do have our draft, we will then be sharing it with the entities specified in legislation for their feedback. And then after that, there's still the internal state review and approval process for documents before they can be released. So we have a ways to go. But we are in the middle of it. And, it's just been such a privilege to do this work. It really has been. And yeah, we're looking forward to moving forward. I think I want to pause there. I don't know if there are any questions, if there's anything more I can elaborate on, or if anybody from the team wants to add anything that I've forgotten. Actually, I do want to say one more thing. Sorry, I am going to say one more thing before I pause, is that this is not an emergency plan. People think of it sometimes as an emergency plan, and I think it's because counties will be folding our guidance into their emergency plans. But we know, when I think of an emergency, I'm thinking, okay, the wildfire's burning, we've got homes evacuated, we've got people losing property, we've got, there's all of this evacuation, loss of property cleanup, and smoke and everything that's going on at that immediate place. But we know that so often our communities are blanketed in wildfire smoke when the fire is far from them. In fact, the fire might not even be in California. So we need to think about wildfire smoke, not just during the emergency, but so it's not an emergency plan. And sometimes people misunderstand that, but it is a plan for whenever we have the AQI going up. So anyway, that was my last sentence on that. Okay, I'm pausing now. I'm going to stop sharing my slides.
Awesome. Yeah, that was so incredibly informative, and thank you all for the work you guys are doing. We're thrilled to see it, and the hard details, the survey results are so fascinating and eye-opening. I'll also pause. If folks have questions, please either add them to the chat or, if you want to just raise your hand, I'm happy to unmute you. And we can go from there. And then also I want to give an opportunity to the team if they have anything else to add before I open it up to questions. Okay, well, we have a question here. I'm going to open it up to Jennifer Tannehill for our first question. Jennifer, I think you should be unable to mute.
Hey, everybody. Just wanted to say thank you so much for all your work on this. I'm Jennifer with the California Society for Respiratory Care. And so we were really happy to see the bill pass and then to also hear all the good work that you guys are doing to implement it, and want to be a resource for you whenever we can be helpful. Please do let me know. I lobby for them, so I am not an expert myself, but I can gather the experts really quickly. So love to be part of the process, and thank you guys so much for all your work.
Well, thank you. Yeah.
Thanks, Jennifer. I'm not seeing any questions come in. I have a question. Judy, you mentioned the toolkit early on in the presentation. Would you mind elaborating about that a little bit?
Sure. So it's, like I said, it's being developed for community health workers so that they can go out and teach within communities. It's in 5 modules. It's very interactive to help with adult learning. We start out with what are the health impacts of wildfire smoke? How do you know that the air is bad? What is the AQI? How do you work with the AQI? What does it mean if it's 120 and my kid wants to go play soccer? Can my kid go? Do I leave my, like all the issues? We work through all of this to have people really try to think about what it means. What does that AQI mean, and what are the things they can do or shouldn't do? And then we have a whole module on how people can protect themselves. There's a whole module just on masks and the different kind of masks and how to wear them appropriately. And there's that. So then we also have how to build a clean air room, and when, why that's important and how that's helpful and all of that. We have a section on air cleaners, purchasing an air cleaner. What do you look for? How do you use them? Why do you use them? And also, if you can't find one, how to build one yourself as a temporary measure. And then we have a special module just for considerations for workers. What are workers' rights, and what can workers do to help protect themselves? So it is as a PowerPoint presentation. It's in both Spanish and in English, and it's when it's finalized, it will have a little kind of a accompanying guide, so someone can actually pick it up with scripts and teach. And we really are looking forward to getting it out. Like I said, that counties don't have the capacity, the resources to do this kind of work, and we know that this is so important. People want this information. They really do. People want to be able to protect themselves and their families. So we're just trying to, in the spirit of the legislation, this will be it will be folded in and part of our guidance recommendations. It's as a resource.
I just wanted to add to Judy's comment. We did pilot the curriculum. I mean, we're calling it a toolkit. With in Merced County and Fresno County, with 2 of the organizations mentioned on the slides. We got some really good feedback. We updated it. And that it's not just for community health workers, it's for anybody working with communities. So folks like you guys, NGOs, CBOs, folks like RAMP, who I saw Brandon and Anne on the line. So just that, and that, if there's anything I would want to apologize for, it is the wheels of progress in state government. So the first 2 modules are ready to be released. They're approved. Everything's approved about them. Now they have to go through an ADA process so that they can be easily used with screen readers. So we want to make sure we do that, but it takes time. And there's at least 2 more modules that are ready to be reviewed and go up this chain, and then they'll have to also go into the ADA process. So it's coming. And there's one other thing I wanted to say with respect to the person from the Respiratory Society. I just want to say that we certainly will have Breathe Southern California and the Respiratory Society and other organizations provide feedback on the plan, understanding it's not an emergency plan. So we'll send that out to you, Tigran, and we'll have you invite any of your membership or your collaborators when it comes time.
Thank you, Lori.
Yeah, sounds great. Looking forward to seeing that, and also, yeah, looking forward to seeing the toolkit. Sounds very, very helpful and informative. Mark Carell, our president and CEO, is also on the line. I think he has a question. So, Mark, I'll turn it over to you.
Hi, thank you, Judy. Thank you, Lori, and thanks for your team for.
Oh, Mark froze.
Yeah, Mark, I think you froze, unfortunately.
The work that you're doing. So let me take them one at a time. Can you hear me better now?
Yeah.
Okay. It's interesting, if I turn off my Wi-Fi, it's a better signal. So I want to thank, I don't know if you heard, I was thanking you all for the work that you're doing, but I have 3 questions. And so the first question is, you've mentioned several times that it's not an emergency plan, and it was never, when we sponsored the legislation, it was never intended to be an emergency plan, but the legislature wanted it in an emergency plan for the counties, so that they're putting it in something that they're already doing, and it was not as put as a mandate. How are you, in your plan or recommendations, trying to clarify that there's a role for the various county departments of public health continuously, and not just when there's a smoke event, but to prepare for it and to have someone assigned and be implementing it all year round?
Yeah, we are definitely addressing that fact. I mean, because there is that misconception, and the intention is anytime the AQI is high. So yeah,
okay.
It is relevant year round in California. It is relevant year round.
Secondly,
well, Mark, I can add a couple of things that
okay.
might shed additional light. We want you to know that we've talked to multiple kind of climate change committees within the state health department. We've been collaborating with local health jurisdictions and managers or coordinators in the county levels who want to know more. We've talked a lot about the plan, we've talked about the survey, we've talked about the toolkit. It's kind of interesting. They're very interested in the toolkit. So it says to me, with the interest that they have in that they have people they'd like to use it. The stockpiling question that is in the legislation, which is great. We're meeting with people to understand what the current system is for stockpiling, and there are some challenges. For example, if there is an emergency, then local health jurisdictions can ask for masks. If there is no emergency, it seems that there's more issues with getting masks to counties. Also, this legislation in many ways puts an unfunded mandate on counties to use the guidance from the document to maybe train people to think about outreach and education, and that is and potentially be conduits of distribution of masks. And it doesn't matter, and we know this now from the state, that there are many, many, maybe 1 million masks in warehouses across the state. But if you don't have good relationships with community organizations, or you don't have a plan to get those out there, then it means that as much stockpiling can happen as we want, but if we can't get the masks to the people who need them, or air cleaners, which is going to be harder. So all of those are things that we're taking into consideration when we're thinking about local health jurisdictions, and thinking about how they might be able to operate to put the plan into place. I think it, you know, may require a bit more legislation with a bit more with more funds. As you know, that AB 619 had $50,000 in it as a kind of consulting stuff. That decreases every year because of, you know, staff salaries, et cetera. So I don't think that the counties are necessarily, at least the counties who most need resources, can do this on the you know, on the budgets that they currently have. I think they're willing to do it. They made those relationships during COVID, but if they have no coordinator and they have no funds to give to local organizations, or you know, stipends, it's probably going to be a harder push. But the plan will be there as a guide to start those conversations.
My second question is, given the increased awareness, particularly after the Eaton fire and the Palisades fire, of not just the particulate matter and not just the smoke that comes, but the contents, the toxicity, the burning the car batteries, and other items that we really don't test for, let alone know all the components of. And I think one of the things that people became aware of during those fires is the AQI is not a perfect system, because it's measuring particulate matter in the air, but it's not measuring any toxins in the air, or toxins in the dust that settles on the ground or in people's homes. So is there some something in your plan to help give guidance on that? That's probably something that counties really don't have the resources to deal with, though. And that may be something that there needs to be directives to CARB or the air districts. But you know, that's so. Has there been any thought to that?
You want to answer that, Lori, or I can answer that? Either way, go ahead.
Thought, no. Part of I think you're right that there has to be a directive to CARB, because the air monitors that are used in the AQI, you know, the science is still developing around that. Yep. It's quite expensive, and there's not a universal system that's, you know, evidence-based of how do we monitor these things in the air. So until that gets better, I think there are things that will help people in the curriculum just by virtue of the fact that an N95 will help with some of the air toxins, and creating a clean room. There's directions around cleaning. You know, you have to clean frequently with, you know, non-toxic stuff like soap and water. So indirectly, maybe some of that will help, but until we have some kind of regulatory system that effectively communicates what those toxins are, then I think it's unfortunate. But this is just geared toward wildfire smoke. And we feel your pain.
Yeah, it is a living document. That's how I look at it. So this is, you know, we're going to come out with the first iteration, and as the science and as CARB and whatever policy catches up, then we will, it'll get fleshed out further.
Okay, thank you.
Any other questions from our attendees? I'm going to open it up to Thomas Edmonds. Thomas, you should be good to unmute.
Hello, thanks. It's a very interesting study. We're looking forward to reading it. I'm the director of a CBO in the East Bay, and I've been following all the stuff in Texas, as you all certainly have. And I was thinking about the emergency announcements and the people you surveyed said that they prefer to get text messages through their phone through this WEA system from FEMA, wireless emergency announcement. So in California, who would do that? Would that be the state of California, or would the counties be required to be members of this iPause system and have the software to issue those announcements?
Yeah, we actually don't know that yet. We're still trying to figure some of this out. Technically the guidance is for counties and it's administered at a county level, but obviously whatever the best science is and the best available tools will be what ends up being incorporated, and we just still have more work to figure some of that out.
Yeah, I would just add that the way that these systems work and state government works is usually there's funding source from the feds of some sort, like maybe in this case it would be FEMA, although that seems to be going away. So some other federal funding source, if they're going to invest in that, it would be then money would flow to state government. In this case, the case you mentioned, I'm assuming it would be the governor's office on emergency services, and every county has office of emergency services. So it would probably the funds, if local funds are necessary, would probably, or devices, et cetera, would probably trickle down from OES, the Office of Emergency Services, or the governor's office of emergencies. So that's the way it would work. If there were access to something like this.
Thank you. All right, I'm going to go last call for any questions, and then we can wrap up here. Seeing none. Yeah, I just really want to thank all you guys for obviously, one, being here, two, for this incredible work you're doing on an issue that's clearly very top of mind for all of us and all of Californians. We look forward to seeing the documents as they come out and the progress of implementation of this as well. The goal for us at Breathe SoCal is to continue our efforts on wildfire smoke mitigation. We're hosting a number of different briefings going forward as well, and I think we'd be more than happy to host another one similar to this as a continuation of just hearing updates on how progress is going and frankly how we can be helpful. I think we'd all be happy to help. We got some folks in SoCal, some in the Bay Area, so we got people everywhere, and we're happy to play our part. So yeah, again, thank you so much. I'm gonna give everyone 7 minutes of their time back on this beautiful Friday. And keep an eye out for any future outreach from us. Yeah, thank you.
Thank you very much.
Thank you, Tigran, for the invitation. We enjoyed talking with your membership.
Of course, anytime. Have a good one.
Bye.